New tonight, a doctor with ties to Richmond has tested positive for Ebola. Thanks for joining us here at 11. I'm Julie Bragg. Dr. Peter Stafford caught the virus while treating patients in Africa. Our Tracy Sears tells us more about the doctor's connections to VCU and what health experts are saying about the outbreak.
The American doctor working with a medical missionary organization in the Democratic Republic of the Congo, who tested positive for Ebola, has ties to the Richmond region. According to the missionary group Surge, Dr. Peter Stafford was exposed to the Bundi-Bujo Ebola virus while treating patients in the Congo city, Abunia. In the Congo and neighboring Uganda, there are more than 250 suspected cases and 80 suspected deaths so far in the Ebola outbreak, according to the World Health Organization. Before moving to Africa, Surge says Stafford and his family lived in Richmond, while Stafford completed his fellowship in burn surgery in 2022 at VCU Medical Center. Rebecca Stafford is also a doctor who works with the Religious Aid Group. According to the Centers for Disease Control and Prevention, Peter Stafford, Rebecca Stafford, their colleague Dr. Patrick LaRochelle, and the Staffords' 4 children are being taken to Germany for treatment and observation. The CDC says Peter Stafford is the only person currently showing symptoms after exposure to this particular strain of the Ebola virus.
They didn't test for this particular strain of Ebola, so it could have been going on for a few weeks. My concern is just this thing's big, and I think it's bigger than we realize.
Grace Tran was part of an Ebola response team that partnered with USAID before funding was eliminated by the Trump administration last year.
Response is very complicated, and there's a lot of training that has to go into it to make sure that response is done well. That funding disappeared. Funding for Ebola programs disappeared last year.
The outbreak, transmitted through bodily fluids, is only the 3rd known outbreak of this strain of the Ebola virus and has no vaccine or treatment.
Now, the CDC says they have activated their emergency response teams or are headed to the DRC. The U.S. has also temporarily suspended entry into the United States for non-citizens who have traveled in the last 30 days to the DRC, Uganda, or South Sudan. Americans, however, are exempt. Julie?